Hello, this is Mayor Michael Butler, and you're watching Orangeburg Educational Network.
We're at the Regional Medical Center, and we have the good pleasure of having Mr. Greg Dressel, who's been on our radio program on several occasions. He's now taking on several new positions at the Regional Medical Center, and we wanted to have an opportunity to have a conversation with him about some of the things that are going on. And I guess we're going to launch this discussion, Greg, with the question, is healthcare broken?
Yeah, and it's not. The healthcare system is not about healthcare right now, unfortunately. The healthcare system is really about putting a plug in the dike and trying to put the cat back in the bag. Once the cat's out of the bag, hurts. So what we need to do is get better at helping patients reverse disease, get healthier. Unfortunately, I think that medicine and the healthcare industry has sold that medicines fix everything. Mm-hmm. And the reality is that our lifestyle and our decisions to take care of ourselves matter the most.
Is the message regarding having an active lifestyle, exercise, is that reaching the public to the degree in which it should be? Or are people just being bombarded more and more that medicines are the answer? All these commercials that they get every day that tell them that they need to take this and take that. Which one is more, which message is more, pronounced?
It's improving, okay? I think in the last 2 years, the message about diet and exercise and lifestyle choices has made dramatic impact and inroads. It's not where it needs to be. America has, too much fast foods, not enough vegetables, not enough good vegetables. Lots of areas of America are what we call food deserts. This area in itself is really a food desert.
Explain what you mean when you say food desert, if you will.
The quality of the food is just poor. If you go to the produce section, the produce sections are just not good fresh foods. They're not multicolored vegetables. A lot of people think if they're having French fries, they're having vegetables, right? And so we in America are not getting enough vegetables. When you eat vegetables, you should be eating lots of colors. There should be one of every color in every meal. That's where you get all those phytonutrients. And we have to change that.
Do you recommend a salad before dinner and before or during lunch as well? Do you recommend that as perhaps a part of the solution?
Well, that might be part of the solution, but then people put stuff on the salad that's not very healthy, right? So, finding vegetables and finding ways to cook vegetables where they're enjoyable. Just, broccoli alone turns on all kinds of things and protects people and shuts off all kinds of things. Cilantro has detoxification properties, asparagus, Brussels sprouts, all of those things have really protective properties beyond phytonutrients.
And now phytonutrients, explain to our audience what phytonutrients are, if you will.
Well, phytonutrients are the things that we need to fuel the cell, to heal the cell, to create new cells. They're just part of the whole basic intake.
And some good examples would be?
Of the phytonutrients, all those colors, the bell pepper that's red, yellow bell pepper, just the colors. That's where you're going to get the phytonutrients. That's why the pomegranate juice and the grapes and the things like that. Those colors, blueberries, those are full of phytonutrients. So, and we don't want people drinking pomegranate juice because pomegranate juice is just full of sugar, and the sugar's not a very good thing either. So that's part of the issue.
You mean the prepared or processed sugar?
Yeah,
Not the natural sugars that's already in the.
That's right. They've added a lot of sugar to that. So
somebody might think that they're eating healthy, In all actuality, they're really not.
Right.
What about some of the carrot juices that we see that are in the
You
supermarket?
have to do a lot of label reading. You're better off if you're going to do something like that is juicing it yourself and having control.
Because I love carrot juice. I know carrot juice is really good. But again, as you say, you've got to read the labels, see how much sugar is there.
That's right.
Ladies and gentlemen, this is Harvey Elwood, New Perspectives, and we're here at the Regional Medical Center with Mr. Greg Dressel. And we're talking about health, of course, and we're talking about all the things that are out there that we need to know about. We talked about exercise. Now, a part of what your responsibility here as a Regional Medical Center is to deal with exercise or active lifestyles. So talk to us about that, if you will.
So, in America, we don't get enough exercise. And exercise does not have to be in a gym necessarily. So, probably people need to have 20 minutes of aerobic exercise a day, every day. And that doesn't have to be necessarily in one setting, but it does need to occur. You can do that by parking at Walmart and parking all the way out and walking in, by taking the stairs instead of the elevator. It's that getting your heart rate up, that using those big muscles like your thigh muscles, that helps to burn sugar and helps to improve insulin resistance.
At what age would you recommend people not engage in exercise?
Never.
Exactly.
Yeah, they need to be exercising all the time. And I think that, even when people have chronic disease, there are things that they need to do when they're exercising. They need to be careful and they need to rest and they need to not overdo it. But they do need to exercise. Even people with bad heart failure, there's studies that demonstrate that exercise improves their outcome. But that exercise needs to kind of be careful. They shouldn't go out and try to run a medically shared visit. What you do is you spend about once a week with a group, and you do a bunch of education to help patients get control of their disease.
Is that in all areas? Can it be done with diabetes and heart disease? And
Yeah, it can be done with anything. So in the Healthy Living Center, we're about to start doing medical shared visits for diabetes alone. Okay. And so,
how many people will participate in a group, if you will?
So the group would be between 10 and certainly not over 20. 20 is a little bit too many people. I think 16 is probably the ideal sweet spot. How's that? And the plan would be that we do some things that we wouldn't normally do. And the focus of each visit is there's going to be a team there, both a dietitian, a certified diabetic educator, myself, exercise physiologists, those kind of things, so that we do this as a team, and we help people better understand, number one, why they need to take care of themselves. So if people don't understand why they need to take care of themselves, they're not going to be participating.
One of the things that I learned was that people were more active and more apt because they themselves were speaking to each other. That the medical professionals they held off and they waited to hear what all of the people around the table had to say as they engaged in the conversation. So they were able to gauge or get a barometer of just where people's thinking was, or what they had known about their own disease. And then the medical professionals came in and gave them the raw truth, I guess, if you will.
Right. And there's some things that are old wives' tales that we need to correct. Okay. Yeah, we need to get things straightened out. And there's some, partial truths and inaccuracies, and those are the kind of things we need to work on. So, when we do the medical shared visits, that's what we're working on.
Particularly here in the South, we have a lot of things where at one time people, not to say that they didn't work, but right now some of them are antiquated, using leeches and cobwebs and all of these other things. If you don't have access to current medical facilities, I guess you would need that kind of stuff. But today that's not needed, I would imagine.
Yeah, well, things change. So, we need to help people understand stuff. So in these medical shared visits, we're going to make trips to the grocery store with a dietitian. We're going to teach in the grocery store. We're going to go to the cooking kitchen, teach them how they can eat without salt, and prepare good meals, and give them some ideas. We're going to do, the basic educational stuff, but it's going to be a lot different. Okay.
You're going to try to make it fun so that people won't get bored and they'll want to be involved?
Right. And so, one of the things is that, when a provider has a 15-minute visit and no backup, no dietitian, no exercise physiologist to help them figure out some ways to move more, well, that doesn't get done. And so these medically shared visits are really taking off nationally because they're dynamic and they make a dynamic change in a chronic disease state. Diabetes is reversible in most patients. So at Tufts in Boston, that group, the Diabetic Reversal Program, has a 25% success rate at reversing diabetes.
And it's just the same shared session where people sit down and begin to talk and are educated by trained medical professionals.
That's right. And they're doing lifestyle, helping people make lifestyle changes. And, I can tell you from experience that when I get a patient to make one change, then they make an impact in their health. When you get them to make two, and then maybe go for the third, it makes huge impact in their health. And the people who are having that 25% who are reversing their diabetes are making a lot of change. And they're using health coaches.
We hope that this will spark some energy in the minds of people, that your words and your teaching will somehow resonate with them and add some new truths to their lives. This is Harvey Elwood. I'm at the Regional Medical Center. I'm here with Mr. Greg Dressel, and he's a nurse practitioner who is extremely knowledgeable about a variety of things when it comes to your health care. We want to thank you for the session, for watching it, and we want to thank you, Mr. Dressel, for being a participant with us.
Thank you.